Now, one of the UK's leading doctors has quit the British Medical Association over planned strike action, claiming it could damage trust in the profession. Well, IVF pioneer Lord Robert Winston joins me now. A very good morning to you. Thanks so much for talking to us today. So talk us through this decision, Lord Winston. Why have you decided to resign from the BMA?
Well, I've got very serious concerns about the way the British Medical Association is behaving and the way it's run. And I think there are a lot of issues which need to be raised, but this is a very good moment because they have encouraged, effectively, young doctors to strike. And in fact, this is only a minority of doctors, but of course, very few people have actually voted in this whole decision anyway. So it's hardly a democratic decision. But in any case, it's thoroughly damaging. It's damaging to the doctors, it's damaging to the profession. Most importantly, it's damaging to patients, and the risk of taking one's work out means inevitably that somebody, at least somebody, will die, even if it's only a matter of 1 or 2 days after the strike has started. And people are waiting on longer lists, which are going to be completely further messed around. And it is, I think, quite a shocking decision to make.
Well, the BMA say they want a 29% pay rise. That they say that's to restore pay for resident doctors, who used to be known as junior doctors, of course, after years of wage erosion. They talk about it equating to resident doctors working for free a fifth of the time. Do you think that should, though, be addressed? And if it isn't there a risk that doctors might leave the profession or leave the country?
Well, first of all, I rather challenge the issue about the inflationary figures that they're quoting, because I think they are risky at best. But in any case, even if they're true, there are all sorts of ways that the doctors should be and can negotiate. There are various options that might be offered, but of course, the right decision is to ensure that Wes Streeting is brought into those discussions and that he has a chance. The government have done their very best to meet the doctors, and what I have to say is that it's very clear that most of us entered medicine because of the altruism involved. And of course, threats of strike have been ever since I came in 60 years ago as a member of the BMA. But actually, like most doctors, I've never been on strike and would not countenance it because I do not think it's in the best interests of anybody. There are different ways of dealing with the disputes, and this isn't one of them.
And so talk us through a little bit more how you would like to see the BMA tackling this. They obviously are concerned about doctors' pay, but also there are concerns amongst doctors about the conditions they're facing. Do you agree that they have a point there, and how could that be tackled?
Of course I agree that. And the conditions have gradually got worse over many years. For example, people on call don't often have a bed to sleep in, even when in fact they're exhausted after a night's work. They might even have to share a bed with somebody else who's also on call. There are all sorts of complete irregularities. The failure to have a decent meal at the end of a shift because it's not within the hours of when the stuff is being prepared. I've seen this, I've been involved in that myself. I've often come back from a shift in the past where, in fact, there wasn't a proper meal. And in fact, I didn't actually have a decent room to sleep in, which was private. And so, although, of course, I'm now retired, I can still see that fatigue and that unfortunate consequence on behaviour. I think, to some extent, this has been really manipulated because, let's face it, less than 1/5 of the doctors have actually voted for this strike.
So what do you think the impact of the strikes will be? Sum up what you think it means for the health service and for patients.
Well, you know as well as I do, there are people on waiting lists who won't get their operations done, as like last time. There are people who actually will be suffering, unable to find a doctor, and may actually end up, perhaps for a long time, in casualty, dying while they're waiting for somebody on a trolley. This is already happening. The NHS is absolutely at stretch point at the moment, and therefore it's really important that we either support healthcare, or if we don't, then maybe we should resign and do something else. But actually, there are no shortage of people who want to be doctors. There are no shortage of good people who would like to be doctors. So I think we have to really ask ourselves, what are we doing medicine for? If I was a medical student now, I would still want to do medicine. Of course, what we have to do is to try work how we can improve the system. That used to happen much more. There needs to be much better negotiation.
And what do you make of the Health Secretary and the job that he's doing at the moment? He will quote monthly figures published this week showing that the NHS waiting list has fallen to 7.36 million. That's the lowest level for more than 2 years, but it's still very high, isn't it? How satisfied are you with the performance of the government so far on the NHS?
Well, I'm sure he's not satisfied either, but he's doing his best. Actually, how you calculate the waiting lists, of course, depends anyway. I don't want to comment on waiting list figures because actually that's really not an issue here, although I think it is important that people will obviously be longer on a list. I think West Streeting is doing his best in a health service which for a long time has been left underfunded. I think the real question, which we're not actually facing nationally, is how we get all political parties to look again at the NHS and review actually the funding model, because that is actually something that now is time. When the NHS started, it's worth consideration that the capitation fee per patient was only 10 and sixpence, less than £1, half of £1. Now the average capitation in England is about £3,000 per patient. That's what we spend. The NHS is not free at the point of entry. Of course, it's all part of our taxation. So how we spend our gross national product becomes important, and how we spend it in the right way. But we don't even know what each treatment actually costs, because the model of funding is not adequate any longer, and that needs to be looked at very carefully.